when I entered medical school, sulfa had been just invented, and so we used sulfa powder in abdominal wounds, and it was a miracle. You know, the infections were stopped, and it was just amazing. And then, and that was I started medical school in September of '41, and the war started in December 7th of '41. So it really was during that time. And then it was in about 42 or 43 that penicillin was discovered. And this was another huge miracle. And towards the end, we were beginning to get into the use of steroids, just beginning. And then, of course, all of the different procedures that came about because of the war injuries and so on. Much to my dismay, pregnancy became a disease too, and the interventions that we were taught with high forceps and all of that kind of thing. An interesting thing happened years later. I had a young student who was following me as a preceptee, and I was doing a home delivery. Or no, it was a hospital delivery, but we did the delivery and all of that, and afterwards, he said to me, I was taking him back to the hotel, he said to me, that's the first, and he was from the University of Cincinnati, first natural delivery I've seen without forceps. So even at that time, they were being taught that the natural, normal delivery was outlet forceps were what were being used. So pregnancy and delivery became a medical.
Right. When I was in medical school, every woman got an IV and a episiotomy, shave, and enema. Yeah. And if they asked not to, the woman would be scorned. That
absolutely, absolutely.
Ridiculed.
My first four were that way.
And one of my points in the lecture is the force of the culture that wants to change this paradigm shift. So maybe you can talk about, because all of our other medical shifts have been done by authority, brought on by authority. Now it's brought on by our culture. Demands.
Well, yeah, one of the things that, first of all, we don't deliver babies. The patient delivers the baby. We just have delivery, and I'm trying to get away from saying that I deliver babies. I delivered 6. Otherwise, I would get to help with the delivery. But I'm really dismayed about the C-sections that are being done right now. When I came back from Afghanistan and was so shocked about how the Afghani women were delivering their babies, I realized that in reality we were doing the same thing at a different level. They didn't understand the physical part of delivery. We have completely ignored the spiritual, emotional part of having a baby, in that we're doing elective C-sections, which should be between 5 and 10%, and in Arizona now they're over 35%, going up to 50%, which is totally, totally wrong. So where the Afghani women interfered with the physical part of the delivering the baby, we have stepped into the spiritual part, and we don't have a clue what we're doing there. It's totally wrong. When I started the practice of medicine back in Ohio, Nestle had just come out with the formula. So all of a sudden, instead of women nursing their babies, they have these ridiculous bottle sterilizers, and they have to have special kind of bottles, they have to have special kind of nipples, they have to go through this whole procedure that the young mothers, it was crazy making. And but that was the modern thing to do. I talked myself blue in the face trying to get women to nurse their babies, but they were modern women. They didn't want to do that. Now what's happened has been that C-section is the modern thing to do. It makes no sense. It's a surgical procedure. It's much more painful than having the baby. Sure, you have the baby, you have pain and all that, but you can work with that, and there are ways of dealing with that, and women know how to do that. They've been doing it since Eve had her babies. We really know how to have babies. We're constructed to have babies. all what we really need is to have support when we're delivering our babies. Now, there are times when C-section is necessary, and that's another whole story. But it's not anywhere near,
35%.
not anywhere near 35%, no.